Welcome to our TED Talk on the case study of unplanned weight loss by Audrey Brazel and Dana Lindman. JB is a 20-year-old female college student who presents to the Student Health Center for an annual visit. She admits to a decrease in food intake with a recent 18-pound weight loss. She is also complaining of fatigue, dry skin, and a recent sensation of her menses for the last 3 months. Her history is negative for obesity and she reports no family history of depression or mood disorders. She takes no medications and does not drink alcohol or do drugs. The diet history that we should obtain should include asking about her appetite and her usual intake of food over the last 24 hours with her total calories consumed. She has money to buy food, and is she able to prepare food since she was in college? If she skips meals, follows a special diet, eats or limits certain foods for health or religious practices. We would also ask about food allergies, if she takes herbal supplements, appetite suppressants, or uses laxatives. Obtaining information about self-induced vomiting or intentional weight loss would also be important. Swallowing problems, gastric pain before or after eating, nausea or vomiting may also affect her dietary intake. One of the most likely causes of this patient's weight loss would be anorexia. It is important for the provider to tell the difference between the loss of desire to eat and true weight loss. Besides an eating disorder, it would be important to determine other psychological causes of weight loss such as depression, anxiety, drug dependency, and or alcohol dependency. If the weight loss occurred with a normal appetite, other common causes may include diabetes, hyperthyroidism, and decreased intestinal absorption. We would need to determine if she is experiencing starvation from cachexia. If so, the likely causes of weight loss would include inflammatory disease, cancer, or AIDS. Key symptoms of malnutrition can be obtained from the review assistance and physical examination. These may include noticing loose-fitting clothing, others noticing weight loss, decreased mood and frequent mood swings, polyphagia and polydipsia are signs of malnutrition related to endocrine disorders. These can include hyperthyroidism, diabetes, or diabetes insipidus. The patient may also have night sweats and mental status changes. A patient's bowel patterns and stool descriptions can be an indicator of malnutrition secondary to an underlying disorder. Diarrhea and weight loss may indicate celiac disease. Painful, bloody, or urgent stools may indicate inflammatory bowel disease or malignant disease. Serial skin fold measurements can be done to determine percentage of body fat. The patient's muscle mass should be assessed for muscle wasting. Vital signs can show arrhythmias, which is suggestive of underlying cardiac disease. Other signs may include dry skin and hair and poor healing wounds. There are many screenings that would be appropriate for this patient. Obtaining a blood pressure should be done. According to the U.S. National Library of Medicine, blood pressure screenings are important for patients 18 and older. A diabetes screening would also be appropriate. Sexual health screenings such as chlamydia, syphilis, gonorrhea, HPV, and AIDS would be important for this patient. The American Cancer Society recommends that patients aged 20 years and older should be checked for cancers of the thyroid, the mouth and throat, and skin during routine visits. Additionally, the American Cancer Society recommends that women start getting pap smears at the age of 21 to screen for cervical cancer. Due to this patient's weight loss, this screening may be considered. We would need to verify that JB has received several immunizations. These will include meningococcal, and depending when she received it, she may need a booster. A dose of Tdap. The HPV is recommended as a 3-dose series. We would need to verify that she has received 2 doses of varicella, 2 doses of MMR, and 3 doses of hepatitis B as a child. Depending on the season, she would also need an influenza. If she is traveling during college, she may also need 2 doses of hepatitis A. In summary, if you have a patient that presents with weight loss like JB, you would need to obtain a diet history, which would include assessing for appetite, the patient's ability to buy and prepare food, and asking about the use of appetite suppressants or laxatives, and also self-induced vomiting. You would also need to consider all the possibilities of weight loss that could be due to psychological causes, anorexia, HIV, AIDS, diabetes, and malignancy. Additionally, you would need to assess for signs of malnutrition. Lastly, you would need to do the appropriate health maintenance screening such as blood pressure, diabetes screening, and screening for STDs and HIV. This should also include any cancer screenings and verify that the patient has received all appropriate immunizations. Thank you.